My name is Jacob, and this is going to be my male straight catheter insertion with an abdominal assessment and a specimen collection. So the first thing I'm going to do is I'm going to check the patient's chart, know that I need to do a catheterization on my patient. I'm also going to look at the chart, and I'm also going to note for any allergies that he has. So there's no known allergies, so good to go. I would gather my supplies, extra pair of gloves. I'd also check the expiration date and note that all the packages are intact and secure before I go to my patient's room, knock on the door, ask to get entry. Once I'm inside the room, I would say, hello, my name is Jacob. I'm a student nurse from Madison College. How are you doing today? Can you state your full name and your date of birth for me? Does that. I'm also going to check his wristband. Okay, that matches up. And I'm going to provide for some privacy here. And I'm going to ask him for any allergies. Did that. And then I'm going to say that I would like to do a full abdominal assessment on you. Once I do that, I am then going to do a straight catheterization because I know you have some bladder problems that we need to look into. So once the patient is known of the situation, the process, and compliant, then I'm going to begin. So then I'm going to start with the abdominal assessment. The next thing I'm going to do is I'm going to do the abdominal assessment. I want to make sure I have clean equipment. So I'm going to sterilize, make sure my patient knows this. Make sure my equipment's all good. Get all that lubed up. Okay. So we have that. Next thing I'm going to do is I'm going to do an abdominal assessment. Also note that this patient, for purpose of this video, does not have an NG tube, does not have an abdominal wound. So with that being said, this doesn't exist. So the first thing I'm going to do with the patient is I'm going to do an inspection. I'm going to note the umbilicus is midline. And with that, I'm going to note the color of the I also want to put a pillow down here to help relax the patient's abdominal muscles, so that'll be a little bit easier for me to do so. Notice the symmetry, any kind of contours, lesions, masses that I can see. I'll probably get down and notice the contour of the stomach itself, and see if there's anything else. The color, make sure there's any kind of dissension, striae, stuff like that. The next thing I'm going to do is I'm going to do some auscultation. Listen. Put these on right. Go this way. Alright, here's a diaphragm. Starting in the lower right quadrant here, I'm going to listen for any kind of bowel sounds, at least for 15 seconds. And once I hear some good active bowel sounds, I'll move on to the next quadrant. Now, if I didn't hear any bowel sounds, I would listen for a full minute in each quadrant, or 5 minutes total. Okay, this is good. Making sure it's not hyperactive or hypoactive. Flip over to the bell. I would also listen for bruit from the descending aorta. Make sure there's no swishing sounds. Okay. I also listen to the femoral and the iliac arteries on each side. Okay. So we're good on that. So that's auscultation. Next thing I would do is I would ask the patient if there's any kind of tenderness on his abdomen that I should note, because I want to do some light percussion. So there's nothing of that nature, so I'll just do some light percussion, listening for tympany. Make sure there's not really dull. Really good. Okay, that's good. And then I would also do some light palpation, in noting that if there's any kind of guarding or any kind of masses that I couldn't see before. Just gonna do some light, starting in the lower right quadrant, working my way around. Trying to stay away from the bladder, because I do note that it is very distended, which is the reason for this catheterization here. So that's all good. The next thing I would want to do, some more hand hygiene here, just because it's always good. Next thing I would do is I would do peri-care. As for agency policy, I'll get the pillow out of here. Sounds good. So then, once I do peri-care, that's when I do this. Alright, I would have gloves on, obviously, and I would start from the tip of the meatus, retracting any kind of foreskin, and doing a circular motion then down the shaft, and making sure that it's clean And then after that, I would start with the straight catheterization on my patient. More hand hygiene. I'm gonna raise the bed, or my table rather. I like it going this way. To above waist height. So as kit's intact, it is good. Okay. There you go. This is going to double as my garbage. Okay, put that at the end. So then, opening the kit away from me. Only touching the outer edge of my tray here. I'm going to do that. Alright, so that's good. Next I'm gonna take my sterile drape here. Just looking for the right part to grab. I'm gonna grab that, only touching the outer edge. Okay, kind of get that unfolded. Alright, I have a shiny side. So the shiny side is here, so then I'm going to drape that under the patient, getting more here. And then I'm going to ask the patient to kind of help assist me and raise up his buttocks, so then I can slide that a little bit closer. Alright, so then I have my sterile field set. Next, I'm going to be putting on my sterile gloves. So I'm just going to switch this around so you can better see. Grab my sterile gloves. Okay. Open them up. Like this.
And then I'm going to ask if it's okay that I close your abdomen.
I don't like this here.
I would have
Alright. So
also
it
closed
stays.
my curtain for privacy there.
Okay.
Alright, so first
So I have
we're
my
going to begin with
gloves.
inspection. So I'm looking
What if these
for
things will
any
fit?
extension,
Fit last time.
These are different actually. Okay. So that one's on, very tight. Use my two fingers to go underneath the cuff.
and then we'll move
Alright,
to
underneath the
auscultation.
cuff, here we
So I'm
go.
going to listen for 15 seconds.
There we go. So I got that on. These things up a little bit.
And if the bowel sounds are hypoactive or
Okay, these things are really tight. Okay, here we go.
a minute
That.
quadrant,
And pull that down. So there we go. So we have that.
and then I'll switch
I'm
to
gonna
the
maneuver my
listen
tray.
for any buoys. And if,
And then I'm going to take my drape,
iliac
open this up.
and femoral arteries.
Okay.
From there,
Get
I'm going
this
to
done.
percussion. So I'm listening for
There
continuing
you go. I'm
noise.
going to
It should be
there we
10
go.
We'll go in
Put that right there in my patient.
And then from there, I'll move
Start
on
this.
to
Open my little
palpation,
tray up
noting
on
any
the side.
like wincing or any
Going to
burning
keep my
areas,
container here.
especially
Specimen label.
over the bladder.
And then I'm going to take my lubricant. I'm going to open it up. I'm going to pour it in the tray like
So
that. Get
then
that ready.
we'll perform
Discard.
So
I'm going to prep my my iodine sticks. I already noted for allergies that he has no allergies. So I'd tear this completely open. I would elevate my sticks so they're sticking out, so they're easier for me to grab. So once I did that,
And I'll have her spread her legs.
I'm going to stick this in the tray. So stick up there like that.
I would hand
I'm
my
then going to take my catheter. I'm going to move my tray so it's closer to me.
I would also bring a garbage can.
Moving that right like that, and then having my lubricant tray. So now I need to have a clean hand and a sterile hand. So then what I would do is I would take my iodine sticks, place them down there like that. Be careful not to use the edge there because it might cause him pain. But I would grab the penis, I would retract any foreskin, and then I would take one stick out, I would clean around the meatus, and then done. Take another one, there's 4 in here, so go around and then down the shaft, and then done. Take another one around and then down and done. Round, down, and done. Till all the sticks were done. And then I would dispose of my iodine things. And then I would take my catheter, I would roll it in my lubricant. I would then spread the meatus, and then I would ask the patient to bear down because this is not a super pleasant procedure. But then, he's definitely going to need to breathe some for me. and maybe even wiggle his toes. So then I would open up the meatus and I would insert the catheter, and I would continue inserting probably about 5, maybe 6 inches until I get urine. And then once I do get urine, I would hold that and I would wait until all the urine has been in the is going into the basin right there. And I would ask him how he's feeling. Maybe that feels better, because then his bladder's not all distended. And then after that, I would grab this, because now I got a basin full of urine there. I would then very carefully, all right, I'm going to say that I'm going to tell him that I'm going to be removing it and that he just needs to kind of bear down with me one more time. We're almost finished with this. I would curl this up and I would remove it very carefully. And then I would release, and then I would remove my gloves. Hopefully I can get this thing in here. Let's do it away from the patient and away from me. Do that. Do there, hand hygiene. Okay, good. And then I want to grab some other gloves, so I'm just going to move my table away. Some gloves right here. Just take 2 of them out. Okay. These suckers back on. So then I have a basin full of urine here. I would move my tray over here. I'd want to delicately take my urine tray and just set it over here for right now so I can clean up. I would get rid of all of this. This would just be garbage. I would just throw that right away in the trash. And then the patient can then close his legs, and I would provide for a little more privacy. And then for my urine specimen collection, I would open up my container. The inside has to remain sterile. So then I would open that up. For me, I would like a syringe. I would probably take a syringe and then aspirate some out and then insert it into the container. Or another option would be taking the basin over a urinal or toilet, probably a toilet, not a urinal, but a toilet or a basin of some sort, and then pour some in there. And I would also get my specimen. I would do the name of the patient, the room number, the date, the time, doctor's instructions, what we're looking for, label it, put my initials there, and put this in a bio bag, and then send it right to lab or put it on ice, and that would be done. I would also want to measure the residual urine and note that on how much that I relieve my patient for. So that's done. So my patient is then, his legs back to normal here. I'm going to help him. And I also note in my nurse's notes on how he tolerated the procedure. I would clean up everything, do some more hand hygiene here. Do that. I would make sure that his call light is well within reach. Here it is. Side rows back up. I would also see if the patient needed any other kind of assistance of that sort, or if he needed anything rather. And then I would make sure I would document everything. I would re-cleanse my stethoscope because I used that. Get ready for my next patient, and I would just reassess and then come back in a lot amount of time and see how my patient is doing from the catheterization on him. And that is my video.